Top 10 Common Chronic Diseases in Seniors. According to National Council on Aging, NCOA, 80% of seniors have at least one chronic health condition and 68% have two or more. Despite these statistics, older adults can maximize health and quality of life by managing symptoms from existing health conditions and reducing the risk of developing other conditions. In this video I will share to you top 10 most common chronic conditions in older adults and how to prevent and manage these chronic diseases. But before that, if you love watching video like this, don't forget to like, share, subscribe and hit the notification bell to be updated every time we upload new video. Top 10 Common Chronic Diseases in Seniors. Number 10. Chronic Obstructive Pulmonary Disease. This common chronic disease affects about 11% of seniors. COPD is a disease that includes emphysema and chronic bronchitis. It makes it hard to breathe and causes shortness of breath, coughing, and chest tightness. To prevent COPD or manage symptoms, you need to quit smoking and avoid second-hand smoke, chemical fumes, and dust. Take prescribed treatments. Get flu and pneumonia vaccines. Remain as active as possible. Number 9. Alzheimer's disease and dementia. This illness affects 11% of seniors. Alzheimer's disease is a form of dementia. It's the most common type and accounts for 60 to 80% of all dementia cases. Dementia is an umbrella term for a collection of cognitive symptoms. It's caused when the brain is damaged by diseases like Alzheimer's, many small strokes, or brain injuries. Alzheimer's and other dementias cause memory loss and difficulty thinking or problem solving that interfere with everyday life. To reduce the risk of dementia, you must, or need to exercise regularly, both the body and the brain. Stay engaged in life and maintain social connections. Get good quality sleep. And eat a healthy diet. Number 8. Depression. This common chronic disease affects about 14% of seniors. Depression is a treatable medical condition that is not a normal part of aging. It can cause persistent feelings of sadness, emotional numbness, anxiety, sleep problems, concentration and memory problems, changes in appetite or weight, a loss of interest in activities, and more. To prevent or manage depression by staying connected with people, eating a healthy diet, limiting alcohol, caffeine, artificial sweeteners, and highly processed foods, exercising regularly, talking to the doctor about treatment options like therapy or medications. Number 7. Heart failure. This illness affects 14% of seniors. Heart failure is when the heart becomes weakened and can't pump as efficiently and can't supply enough blood and oxygen to the entire body. This can cause changes in the heart muscle that cause fatigue, lightheadedness, nausea, confusion, or decreased appetite. To prevent or manage heart failure, you need to decrease risk of coronary heart disease and high blood pressure. Number 6. Chronic kidney disease. This chronic disease affects 18% of seniors. Chronic kidney disease causes a slow decline in kidney function over time. That causes an increased risk of heart disease or kidney failure. To prevent chronic kidney disease or reduce symptoms, you need to reduce the risk of diabetes and high blood pressure or managing symptoms, essential because these are the two biggest risk factors for kidney damage. Staying current on screenings for early detection and treatment. Take prescriptions to reduce and manage symptoms. Number 5. Diabetes. Diabetes also affects 27% of seniors. When someone has diabetes, the level of glucose in their blood is too high. This can happen when the body doesn't make enough insulin. When there isn't enough insulin, glucose doesn't get moved into the cells of the body. Instead, it builds up in the blood and causes high blood sugar. Over time, high blood sugar seriously damages the eyes, kidneys, nerves, heart, gums, teeth, nerves, and blood vessels. This leads to health conditions like heart disease, stroke, blindness, kidney disease, nerve problems, gum infections, and amputation. People with diabetes are also more likely to have heart disease or a stroke, and at an earlier age. To prevent or manage this common chronic illness, you need to eat a healthy diet and talking to the doctor about alcohol consumption. Exercise regularly, 30 minutes, 5 times per week to keep blood sugar levels in check and control weight. Lose 5 to 7% of body weight if diagnosed with pre-diabetes. Number 4. Coronary heart disease. This chronic condition also affects 29% of seniors. Coronary heart disease, also called ischemic heart disease, is caused when plaque builds up in the arteries leading to the heart. That decreases the amount of blood going to the heart and can cause additional complications like blood clots, angina, or heart attack. Prevent or manage coronary heart disease by limiting saturated and trans fats, sugar, and salt. Sleeping 7 to 8 hours each night. Reducing stress. Exercising regularly. And of course, don't smoke. Talk to the doctor about managing major risk factors, like high cholesterol and high blood pressure. Number 3. Arthritis. Arthritis affects 31% of seniors. Osteoarthritis is the most common form of arthritis. It's a joint disease where the joint cartilage is breaking down over time. That causes swelling and inflammation, which leads to pain and stiffness. Some people dismiss arthritis as occasional aches or stiffness. But chronic arthritis pain can be so severe that seniors are forced to make unwanted lifestyle changes. Delay arthritis onset or manage these symptoms. You may or need to exercise regularly, ideally 5 times per week for 30 minutes each time. This improves function and decreases pain. Maintain a healthy weight. Losing just 1 pound can remove 4 pounds of pressure from knees. Being careful to avoid joint injuries. And don't smoke. Number 2. High cholesterol. This chronic disease affects 47% of seniors. Nearly half of all seniors on Medicare were treated for high cholesterol. When the body has too many bad fats, arteries get clogged and cause heart disease. To prevent or manage high cholesterol, you need to quit smoking. Reduce the amount of alcohol consumed. Stay active and are exercising regularly. Maintain a healthy weight. Eat less saturated and trans fats. Number 1. High blood pressure. High blood pressure, also known as HBP or hypertension, is a serious condition that affects 58% of seniors on Medicare. It's often called the silent killer because it has no symptoms. But it damages blood vessels and increases the risk of serious and sometimes fatal conditions like stroke and heart attack. To prevent or reduce this condition, you need to maintain a healthy weight. Reduce stress. Limit salt and alcohol. Exercise regularly, daily if possible. Check blood pressure regularly to monitor progress or detect pre-hypertension. With these kinds of odds, you might wonder if there is anything you can do to prevent the onset of a chronic medical condition, or make managing an existing one easier. The answer is yes. To sum up, seniors have many common health issues and everyday issues that need to be taken care of. it is important to stay healthy throughout your life because older adults are expensive to fix. The best way to prevent disease and injury is through exercise. It's never too late to get in shape. In addition, it is important to pay attention to your medical needs and schedule regular visits with your doctor. Be aware of the risks and make an effort to keep your immune system strong to avoid illness and disease. Thank you for watching. Let me know what you think and don't forget to like, share, subscribe and hit the notification bell to be updated every time we upload new video.